Varicella-zoster is a herpes virus that causes chickenpox, a common childhood illness which is highly contagious. Shingles occurs when varicella-zoster becomes active again. The difference between chickenpox and shingles is that chickenpox is a milder illness that affects children. Shingles results from a reactivation of the virus long after the chickenpox illness has disappeared. The Varicella-zoster virus is gram-positive. It's a linear double-stranded DNA molecule, and it is enclosed with an icosahedral capsid and surrounded by a phospholipid envelope. It is non-motile, and VZV-infected cells use glycoproteins to insert its viral DNA into uninfected cells. Viruses do not require oxygen for survival, and VZV may re-emerge later in life as shingles. Varicella occurs worldwide. In countries with temperate climates, it is primarily a childhood disease, with most children infected by 10 years old. People at risk for severe varicella include immunocompromised people, newborns whose mothers have varicella, premature babies exposed to varicella or herpes zoster, and pregnant women without evidence of immunity to varicella. Humans are the only reservoir of VZV, and disease only occurs in humans. VZV causes rashes that turn into itchy, fluid-filled blisters that eventually turn into scabs. The rash may first show up on the chest, back, and face, and then spread over the entire body, including inside the mouth, eyelids, or genital area. For chickenpox, the virus can spread from person to person by direct contact and from inhalation of aerosols from vesicular fluid of skin lesions. If you have shingles, direct contact with the fluid from your rash blisters can spread VZV to people who have never had chickenpox or never received the chickenpox vaccine. If they get infected, they will develop chickenpox and not shingles. They could then develop shingles later in life. The portal of entry for chickenpox and shingles is primarily via the respiratory route, which is by inhalation of aerosols from vesicular fluid of skin lesions of varicella or herpes zoster. The incubation period for chickenpox and shingles is 14 to 16 days after exposure to the virus. Chickenpox illness usually lasts about 4 to 7 days, while most cases of shingles last around 2 to 4 weeks. People who are infected with VZV are highly contagious a few days before symptoms appear and during blistering or rash outbreaks. One is usually contagious until their last blister has scabbed over. The classic symptom of chickenpox is a rash that turns into itchy fluid-filled blisters that eventually turn into scabs. Other typical symptoms that may begin to appear 1 to 2 days before a rash include fever, tiredness, loss of appetite, and a headache. Shingle symptoms usually affect only a small section on one side of your body. These symptoms may include pain, burning or tingling, sensitivity to touch, a red rash, fluid-filled blisters, and itching. Some people also experience a fever, headache, sensitivity to light, and fatigue. Most commonly, the shingle rash develops a stripe of blisters that wraps around either the left or the right side of the torso. Sometimes the shingle rash occurs around one eye or on one side of the neck or the face. Serious complications from chickenpox include bacterial infections of the skin and soft tissues in children, including Group A streptococcal infections, infections of the lungs such as pneumonia, infection or swelling of the brain, bleeding problems or hemorrhagic complications, bloodstream infections, and dehydration. The most common complication of shingles is long-term nerve pain called postherpetic neuralgia. PHN occurs in the areas where the shingle rash was, even after the rash clears up. It can last for months or years after the rash goes away. The pain from PHN can be so severe and debilitating that it interferes with daily life. Shingles may lead to serious complications involving the eye, including blindness. Very rarely, it can also lead to pneumonia, hearing problems, brain inflammation, or death. The most sensitive method for confirming a diagnosis of varicella is the use of polymerase chain reaction to detect VZV in skin lesions. Vesicular lesions or scabs, if present, are the best for sampling. There are 2 chickenpox vaccines that are licensed in the United States, Varivax and Proquad. RZV Shingrix vaccine is a recombinant subunit vaccine, and it is currently the only zoster vaccine licensed and available for use in the United States. Chickenpox typically needs no medical treatment. Your doctor may prescribe an antihistamine to relieve itching, but for the most part, the disease is allowed to run its course. Several antiviral medicines, acyclovir, valacyclovir, and famciclovir, are available to treat shingles and shorten the length of severity of the illness. Pain medicine, either over-the-counter or a prescription from your doctor, may help relieve the pain caused by shingles. Now that we've learned about the Varicella-zoster virus, it is best to remember to get vaccinated. CDC recommends 2 doses of chickenpox vaccine for children, adolescents, and adults who have never had chickenpox and were never vaccinated. Contact your local pharmacy to learn more about chickenpox vaccination.